Hello, everyone.
I hope I am audible to all of you. Yes, I can see. Hi, hi everybody. It's so nice to see all. Okay, I can see all of you joining the session. Great. We'll wait for others as well to join the session. In the meantime, let me introduce myself to all of you. My name is Sabreet. I am the head trainer at Khaira Education. And I welcome you all to this OET All Stars session with Khaira Education. I'm looking forward to share a skill with all of you. There seems to be some problem with my speaker. Just a second.
Okay, I hope this will be better. Okay, right. So in the meantime that we are having the introduction, I would like all of you to introduce yourself in the chat box. I can see many of you are joining the session. Lovely. Of you to introduce yourself in the chat box. I would also want you to mention if you're a nurse or I think, okay, I think there is some echoing that I hear. There seems to be some trouble here. Could you please check if the echoing is there in your case as well? Okay, I can see nurses joining the session. I would also want to know if others, what's your profession? Good evening to everyone. Good evening, Simran. Good evening, Kajal. Good evening, Muskan. Lovely. Great, great. Thank you. Right. So we have many nurses and doctors joining the session. Oh, Simsim asks if this is for nurses or doctors. This is for both doctors and nurses. This is going to be very beneficial for all healthcare professionals. I can see you guys. Okay, someone is from Sri Lanka. We have doctors as well. Lovely. Good evening to everyone. I'm not sure in which part of the world you are. So, good morning, good evening, good afternoon to all of you. Thank you very much for taking some time to join this session. I'm looking forward to have this session with all of you. Again, my name is Sabreet. I'm the head trainer at Khaira Education. I welcome you all again to this OET All Stars session with Khaira Education. Khaira Education is Asia's first premium preparation provider, and we offer a wide range of affordable courses for both nurses, doctors, and other healthcare professionals like pharmacists and physiotherapists. You can join us for either online mode or offline mode, whichever is suitable for you. If you are in India, in the northern part of the country, you can come and join us offline. Otherwise, we also provide online classes. You can reach out to us through Instagram, Facebook, WhatsApp, and the phone numbers as well as the mediums are all there on your screen. So you can feel free to reach out to us. Okay. I can see mental health nurses as well joining the session. That's lovely. Thank you very much for your participation. Right. So this is an OET All Stars writing lesson, as I mentioned in the beginning. And this lesson is about appropriateness of language in OET writing. As you all know, that OET assesses your letters based on a number of criteria. There are 6 criteria based on which your letters are assessed. Each and every letter is assessed by the assessors. One of these criterion is called genre and style. Genre and style is a criterion which deals with the language that you're using in the letter, whether it's appropriate for your recipient or not. And this criterion also checks whether the language that you've used is formal or not. Now, we all know that we are writing a formal letter, and in formal writing, it becomes very important that the language that we use adheres to the formal features of writing. But apart from that, it is also very important that you consider the understanding of your recipient, the person that you're writing the letter to, so that based on the understanding, you are able to use appropriate language in the writing. And when you use appropriate language in the writing, it becomes easy for the recipient or the reader of the letter to understand what you have written. So it's imperative that we use the language that is understood by the recipient. In this lesson of OET All Stars, we are going to learn what kind of language is understood by different recipients of the letter. What are the different recipients that you can be expected to write on the test date? And finally, we are going to master the skill of how to use appropriate language in our letters. Again, I can see some of you have recently joined the session. Again, a very warm welcome to all of you. We have just started the session and I was talking about what the topic of the lesson is. In the meantime, I can see that many of you are sending hi and hello to everybody. I might not be able to respond to each and every hi, but then I am definitely seeing your messages and the comments in the chat box. So it's really nice. Right. So to begin this session, I want you to imagine a situation. In fact, 2 situations. The first situation is, let's say you are a nurse, a doctor, a pharmacist, a physiotherapist who is writing to a doctor. So you're writing a letter to a doctor and you want to convey the diagnosis of our patient, which is of myocardial infarction. And then there is another situation where you're writing a letter and you're talking to the patient's mother. And you want to convey the same diagnosis of myocardial infarction. So to both the recipients, you want to convey that the patient has been diagnosed with myocardial infarction. Now think of the understanding of both the recipients and tell me whether for both of them, you're going to use similar language or will there be any difference in the language that you're going to use? If you think that you're going to use the same language, you can type a yes in the comment box. And if you think you're going to use different language, you're going to change the vocabulary, you're going to change the jargon, then you can type a no in the chat box. So I'm looking forward to your responses. If you think similar language, then a yes. If you think no, you're going to make changes, then a no. Sweetu says no. Okay, Sweetu says we are going to use different language, right? I would wait for all others, all of you to respond. Anu says no. Okay. Navreet says no. Mandeep says no. Sonia also says no. We as well says no. Amazing. Era says no. Sarabjit says no. Mamusa says no. Indira says no. Lovely. Mimi also says no. Shubham also says no. Lovely. So most of you believe that no, we are not going to use similar language. That itself is quite brilliant of all of you because you're all absolutely correct. We are not going to use the same kind of language, the same kind of vocabulary for both of these recipients and in both of these situations, because the understanding of the terminologies and vocabulary is different in both the cases. One is a healthcare professional who might understand what myocardial infarction is and who would actually definitely understand what's myocardial infarction because a doctor usually deals with patients having such condition, while the patient's mother, who is not a healthcare professional, who does not know medical terminologies and who has not been very frequently in healthcare contexts, would not understand what myocardial infarction is. So yes, you will have to use different language for both of them. To the doctor, you can write, yes, that the patient has been diagnosed with myocardial infarction, while for the patient's mother, you will have to paraphrase the information, probably that the patient has been found to have a heart attack, or it has been found that the patient had a heart attack, something like that, but not exactly myocardial infarction. So very good. I can see still responses coming, and most of you have said no. So very well done. Lovely responses. Thank you for responding. Right. So in order to understand what kind of a language is to be used for which type of a recipient, it's very important that you understand what are the different types of recipients that you can be expected to write on your test day. So these three are healthcare professionals of the same profession, of a different profession, and non-healthcare professionals. So let's learn about them, and also let's learn what kind of language is to be used for each of them. To begin with, let's talk about healthcare professions of the same profession. What do I mean by that? Let's say you are a nurse and you're writing to another nurse, or you're a doctor writing to another doctor, a pharmacist writing to another pharmacist, a physiotherapist writing to another physiotherapist. So when you and the recipient, you share the same profession, you do not have a different profession. In such cases, the job roles that you perform would be very similar to the job roles that the recipient performs. Hence, the kind of environment and the kind of terminology and exposure to language at workplace will be very similar. So whatever language as a nurse you understand would easily be understood by another nurse. For example, if you're using medical terminologies and you're talking about the medicine that is to be given to the patient, and you're talking about the dosage details, and you're writing that the patient needs paracetamol BD. BD is twice a day. So another nurse who also is responsible for, as it's a job role of a nurse, is responsible for administering medication to the patient would know what is BD. So you can easily use medical terms because the recipient easily understands that kind of language because they're very familiar with it. Then come healthcare professionals who are of a different profession. Now, what is meant by this? Let's say you are a nurse and you're writing to an occupational therapist, or a pharmacist who is writing to a dietitian, or a physiotherapist writing to a doctor. So the kind of work that you do is very different. The kind of work that the sender does. For example, if the sender of the letter is a doctor deals in medicine, and that doctor is writing to a physiotherapist who does not deal in medicine at all. So the kind of language that you would be using in your writing, you would have to modify that, because the language that you would be using would be related to the medical context, while the language that the physiotherapist would understand would not be related to medicine. So, for example, dosage details, something that we were talking about in the previous example. Let's say you're talking about dosage details, but you cannot write those dosage details to a physiotherapist or an occupational therapist because they do not deal in medicine at all. So they would not be able to understand what you mean by let's say paracetamol be given BD or TDS or main. So these things you as a nurse or a doctor would be familiar with, or a pharmacist would also be familiar with, but another healthcare professional who does not deal in medicine will not be familiar with it. So the language in such situations that you're going to use needs to be very carefully thought. You cannot use any and every medical term. You will have to decide, you will have to calculate what kind of a medical term will my recipient be able to understand. And according to their understanding, you can decide on using a particular medical term or not using it. So when writing to the same healthcare professional of the same profession, you can easily use any medical terms that you're able to yourself understand. But when it comes to another healthcare professional, you'll have to decide according to their understanding. And the decision that needs to be made most carefully is in case of non-healthcare professionals. Sometimes you are expected to write to the patient's family member, or let's say a non-healthcare professional like a social worker or the manager at a retirement home, who are not familiar with medical terms at all, because it's not their work to be familiar with these terms, and then they do not have much exposure to medical terms. So in such cases, you'll have to be very cautious and very careful about the use of medical terms and medical jargon. In such cases, you should not be using any medical terminologies because the recipient will not be able to understand. And if the recipient does not understand the medical terms, your letter will not be a successful letter because the recipient will not be able to understand the letter. So in order to enhance the understanding of the recipient, it's very important that medical terms and or non-medical terms be used carefully. So to non-healthcare professionals, if you're not using medical terms, how do you convey certain diagnosis or how do you convey certain medical terms? In such cases, you always paraphrase, which means you will use a different term which easily can be understood by a layman. For example, if you want to convey myocardial infarction, the example that we saw early in this session, we would convey that the patient, that your son, when we are writing to the patient's mother, that your son had a heart attack. We would not write that your son had myocardial infarction. So in such cases, you always paraphrase, use layman's term, something that can easily be understood by a non-healthcare professional. Now, I know that writing to non-healthcare professional and at the moment of the test, thinking about which kind of words will the non-healthcare professional be able to understand can sometimes be tricky. So I am going to discuss an activity with you, and we are going to get together find the answers to certain terms, such certain medical terms, and we are going to learn how we can change them, replace them, or paraphrase them into non-medical terms. So here is task 1 for you, because I'm going to make you do some tasks in today's lesson. So be prepared with your typing keyboard in front of you, because you'll be commenting which non-medical terms or non-medical phrases are you going to use if you are to write to a layman, and what kind of terms are you going to use for these 8 medical words and phrases that are there on your screen. So let's discuss them one by one. Let's talk about febrile. If you want to write to a non-healthcare professional that the patient is febrile, instead of febrile, what can you write? Please write your responses in the comment box. I'm looking at them and I would love to see. Okay, Ted says high temperature. Good. Era says fever or high temperature. Lovely. Jasbir says high temperature. Sandeep says high temperature. Okay. Sonia says fever. Lovely. Anu says normal body temperature. Okay. Febrile. Anu is a little opposite to having a normal body temperature. Simran says, Navreet says high temperature, fever. Poonam says fever or high temperature. Lovely. Jasbir says increased blood pressure. We're talking about the first one. We are at fever. All right. So let's see the answers. Absolutely correct. Someone having fever, someone having high temperature is someone being febrile. Absolutely correct. All of you got correct answers. Marjo says feverish. Feverish is someone who is not very clear whether the patient has fever or not. That is feverish. Right. Lovely. Let's talk about the second one, hypertension. Let's move on to that, because all of you got the correct response for the first time. Let's say we are writing to a non-healthcare professional. So what do we write for hypertension? Lovely. All of you got the first one correct. Number 2, increased blood pressure. Gina, correct. Lovely. Abhishek says high blood pressure. Poonam says high blood pressure. Good. High BP. Era says BP. Yes. Okay. Irfan says high blood pressure. Great. Imran says higher than normal temperature. That would be for the first one, Imran, right? Indira says high blood pressure. Lovely. Simran, Joy, Aditya, you all say high temperature. Absolutely correct. So for hypertension, it's high blood pressure. And many non-healthcare professionals are very familiar with BP as well. For example, my granny, she is a patient of hypertension. So she does not know what's blood pressure, but she knows what's BP. So high BP can also be used. So you're absolutely, all of you are absolutely correct. Great. Shama says, and Silet says high temperature. Lovely responses. Let's move on to the third one, erectile dysfunction disorder. What would you write for erectile dysfunction disorder if you have to explain it to a non-healthcare professional? If you don't find the exact term, you can also use a description for that medical term. Impotence, very good error. Great. For the third one, everybody, erectile dysfunction disorder. Impotence, Abhishek says. Right, absolutely. Lindsay as well agrees to that. Lovely. All of you saying impotence. Right. So when explaining erectile dysfunction disorder to a non-healthcare professional, yes, impotence would be correct. Lovely. Let's see. Yeah, so you can either write impotence, or if you don't get the word, you can also write inability to get and keep the erection. That's also erectile dysfunction disorder. Lovely. Thank you for your responses. All of you got it correct. Let's move on to number 4. Allergic rhinitis. What do you think that would be? How do you explain allergic rhinitis to somebody? I could probably give you a hint here. It is called a kind of fever in some countries. Not able to have erections, right? That's also correct for the third one. We are moving to the fourth one. Dinesh says runny nose. Yeah, that's a symptom of it, right? You can explain it through symptom as well. Yamikani, right. For the third one, you're correct. We are talking about the fourth one, everyone. Right, runny nose, allergic runny nose. Yeah, that's a description of it. Lovely. Cold, good. Zafida says cold. That's again a symptom of it. Albertina says no erection. That's for the previous one, right? Hay fever, lovely, Anu. Yes, hay fever. It's called hay fever in some countries. My note says having cold. Yeah. So somebody having cold, runny nose and infection, either you can describe it that way, that your ward has cold and fever and runny nose. And if not, you can also call it seasonal infection or hay fever. Let's move on to the fifth one, halitosis. What do you think is that? Right, runny nose, hay fever. Very good, everybody. Lovely. Running nose, correct. What do you think about halitosis? Right, very good. For the previous one, all of you got correct. Era says bad smell. Okay, bad smell from where, Era? You'll have to specify which part of the body. Samira says bad breath. Correct, very good. Bad mouth odor. Good. Sundari says bad breath. Lovely. Yeah, foul smell, Era? From the mouth. We'll have to specify bad breath. Right, very good. Sonia says bad breath, bad smell from mouth. Ramdev says bad smell. Goitse says bad breath. Right. So it's actually not bad smell from the mouth, but when someone is breathing, that is what is halitosis. Bad breath or foul smell, foul breath or odorous breath. All of these would be correct. Lovely responses. Amazing. Let's talk about menses. How do we describe menses in non-medical terminology? We cannot say menstrual cycle. That's also medical. So how do you describe menses? Number 6. Everybody? Bad breath. All of you got it correct. Lovely. He has bad breath. Irfan, yeah, that is how we would describe it. Nady, yes, bad breath. Veera says for menses, periods. Okay, periods. Lovely. Menstrual cycle again becomes a little medical in the terminology, Mandeep. So periods is a better term, right? Period, very good. Period, lovely. Sarabjit says periods. Ramdev says periods. Very good. Loren says periods. Lovely. All of you got menses correct. So yes, it's periods. Let's talk about ambulate. Something that is very frequently used when you're writing a letter to a physiotherapist, probably sometimes to an occupational therapist. It's usually related to the physical abilities of the patient. Ambulate. What do you think about this one? Number 7. Right. You all got it correct for the 6th one. Let's talk about the 7th one. Ambulate. Veera says transfer. Okay. Veera, let's be a little more specific. Who's transfer? Move around. Good. Ability to move around. Sundari, good. Dilip says, okay. Princess says move. Simran says mobility, movement. Mohammed says walk. Darshika says mobilize. Lovely. Mobilize. Nice. Move. Right. Safida says move. Deepa says mobility. Ciliette says able to make moves. Okay, let's see. Right. So the ability to move from one place to another, the ability to walk is what is ambulate. Lovely responses, everyone. And let's talk about the final one, pharyngitis. This is something very tricky, very, I would say, very difficult medical terminology to understand for a non-healthcare professional like me. Pharyngitis, number 8. What do you think about it? Pain in the pharynx. I would not know what is pharynx, Tosin. You'll have to make it easier for me. Let's see what your friends, other people joining the session would say. Inflammation of the pharynx. Pharynx is difficult to understand for a non-healthcare. Swelling in the throat. Yeah, I could accept that. Swelling in the throat is a little better. Infection of the pharyngitis is very difficult to understand. Princess, you'll have to make it easier. Complete non-medical terminology. Sore throat, Mohammed, right? I would agree with you. That's easier to understand. Throat infection, again, easier to understand. Nice. Upper respiratory tract infection, Somi, that's a medical term. Pain and swelling in the throat, sore throat, I would agree with all of you. Right. Sore or painful throat or swelling in the throat is what we use for pharyngitis. Lovely work, everyone. Amazing responses from all of you. And it is very clear that, yes, you all have the capability of using appropriate language for a non-healthcare professional if you have to write to one. So well done. That was our first task. Moving on to the next task. Now that you have understood that we use non-medical terms when writing to non-healthcare professionals, medical terms when we write to a healthcare professional of the same profession, and appropriate medical terms for healthcare professionals of a different profession. Let's see if you're able to decide which statement is better for the recipient that we are writing to. So task 2 involves a writing task, an instruction for you, according to which you'll have to decide which of the two statements is better. So the situation is that you are writing to a social worker who is seeking assistance in the and you're seeking assistance in the rehabilitation of a patient who is recovering from myocardial infarction. So you want the social worker to be involved in the recovery of the patient who is recovering from myocardial infarction. You'll have to decide which statement are you going to use in your letter. I can already see responses popping in. So the first statement is Mr. Faulkner underwent coronary artery bypass grafts following the diagnosis of myocardial infarction. Mr. Faulkner underwent a major heart operation following the confirmation of a heart attack is number 2. I can see many number 2s coming in here. So Bello says 2, Joy says 2, Albertina says 2, Mandeep says 2, Abhishek 2, Mohammed 2, Princess 2, Darshika 2, Anu 2, lovely. Farina says B. I would consider that you're saying 2, lovely. Henry says 2, Tanvi says 2, Neha says 2, great. Zafida says B. Okay, that's 2. Shija says the second one. Akanksha says the second one. All of you are absolutely correct. When writing to a social worker, we'll use the second statement in our letter, not the first one, because the social worker is a non-healthcare professional. They do not specialize in managing the patient's health or treating the patient's condition. They specialize in tackling the social issues of the patient. So, since they do not work as a healthcare professional, they would not be able to understand medical terminology. So, we'll use a sentence with non-medical terminology in our letter, which is the second one. All of you got it correct. Lovely. Great. Another task. And in this task, we have 3 different recipients. If you see on your left-hand side, you have the recipients. Number 1, physiotherapist. Number 2, nurse. Number 3, the patient's husband. And on the right-hand side, you have certain statements. Statement A is Mrs. Markle's range of motion of the right wrist has improved significantly. B, Mrs. Markle has been prescribed antihypertensive and antibiotics. And C, Mrs. Markle has been prescribed medicines for high blood pressure and for management of her infection. So we have to match the statements with the recipient. So if you think the answer for number 1 is C, so you will write 1C. If you think the answer for number 2 is B, you'll write 2B. And if you think the answer for number 3 is A, so you'll write 3A. So match the statements with the recipients and let's see who gets the right response. You can write one by one as well. So let's find the answer for the first one. First one, physiotherapist. Darshika says A. Joy says A. Abhishek says A1. Sundari is given the response for all three. She says A1. Era says 1 is C. Okay, interesting. Memory says 1 is A. Celian says 1 is A. Albertina has also given responses for all three. Patel says 1A. Amreen says 1A, and she's given responses for all three. Okay, so I agree with all of you. For the first one, we will use A because range of motion of the right wrist is a term that is usually used when we are writing to someone who specializes in the physical abilities of the patient. So 1 is definitely A. Let's talk about 2, nurse. When you're writing to a nurse, which statement? 2B, very good. 2B, most of you are saying. 2B for most of you. 2B for most of you. Great, lovely. 2 is B. Mrs. Markle has been prescribed antihypertensive and antibiotics because antihypertensive and antibiotics is a category of medicines. And a nurse does specialize in administration of medicine, so she knows these categories. So lovely. 2 is B. And 3, patient's husband. To the patient's husband, we are left with no other option but number 3 because we have used terms like medicines for high blood pressure and management of infection. Lovely. All of you got right answers. Great job done, everybody. And now I have the final task of the day for all of you, which is a follow-up task. In this task, you are given a writing task. If you can see, the writing task mentions using the information in the case notes, write a letter to the social worker, Susan McDonald, who works at Blessings Community Center at 1009 Moulton Street in Minitown, 4201. And you are explaining the patient's situation and needs. And what is the patient's situation? The diagnosis of MI, myocardial infarction. And then we also have the information that the patient was admitted on 29th of January 2023. And the surgery that was performed was CABG. All of this is medical terms. You are writing the letter to a social worker. So you have to now decide how are you going to paraphrase MI and CABG for the social worker. So in this activity, you will have to write a sentence, and that sentence should have the information about the diagnosis, the date of admission of the patient, and the name of the surgery. All of you can write the responses in the chat box and keep writing them. We'll have a look at them and we'll post the right response in some days once we have received your responses. So by tomorrow evening or day after, we are going to write the response for this question. So you are writing the letter. For some of you who cannot see the screen, let me just try making it a little more concise for all of you. Right. So just a second. Okay, I hope you can see the follow-up on your screen now. So this is the writing task for all of you, in which you are writing a letter to a social worker and you're giving the information about the patient's diagnosis of myocardial infarction, the admission date, and CABG. You will have to write one sentence that through which you will convey the information about the patient's situation to the recipient. So you will have to decide what's the job role of the recipient, whether they are able to understand medical terms or not. and accordingly write the sentence. Keep writing the sentences. I can see some of you have already written the sentences in the chat box. Keep writing them. I'll post the right answer tomorrow under the same link so that you can check the answer. So what did we learn in today's class? We learned that there are different types of recipients to whom you can be expected to write your letter. And it's you who will have to decide and understand the understanding ability of the medical jargon of the recipient and accordingly use words, phrases for them. If they understand medical terms, you're free to use them. If not, you will have to paraphrase and use synonyms to convey the same information in layman's terms. That would be all for today's session. Again, thank you very much for joining the session. Thank you very much for taking out the time. And we are Khaira Education. This lesson was presented to you by me, Sabreet, the head trainer at Khaira Education. We offer both online and offline courses. So if you would want to join us, please get in touch. We will bring up similar lessons in the future as well. Thank you very much for joining. I'll see you all soon. Thank you. Bye-bye.